These were men who had been tested and had no prior psychiatric histories and certainly no eating disorder histories. With weight loss, they started to become increasingly depressed, irritable, and depressed. They became preoccupied with food, and I mentioned some of the things that might happen. Eating became a ritual, so they would be obsessed with the times of meals. Some of them would also find themselves sort of scrounging for food outside of meal times, thinking a lot about food, reading magazines about food. They displayed decreased libido, an interest in sexual activity, and they became socially withdrawn and isolated. So part of what we can take away from this, and I will also mention there were some individuals who actually had more extreme symptoms. One individual became arguably quite psychotic and engaged in some of these questions might also pertain to symptoms, of course, of anxiety and depression, so they're all interrelated and all important. I'll kind of normalize things by saying sometimes a person may overeat when they're feeling particularly depressed or down. Is this something that ever happens to you? Sometimes a person may feel guilty after eating, so they'll avoid eating certain foods for the next 24 hours. Is that something that you've heard about or something you've ever experienced? Again, focusing on the relationship between eating and mood. Do you ever eat because you feel happy, angry, depressed, guilty? What sort of drives someone's eating behaviors? And then what would it be like to gain or lose 3 pounds? Do you feel like you would notice? Do you think other people would notice? How would you feel about yourself? How do you think other people would perceive you? Do you think it would affect your ability to take a deep breath? Because I think what we know about anorexia and what we can do or provide in terms of treatment is a little bit abysmal. And maybe the message is just we need to do a lot better, and we need to try a lot harder for our patients. So any of the randomized controlled trials that have been done for anorexia have not suggested that any one treatment is effective, and certainly hasn't demonstrated that one particular approach is any more effective than another. So what that means is the status of treatment for anorexia nervosa is inconclusive, and there is no kind of recommendation beyond full weight restoration as the best predictor of recovery, remission with these changing and it can start to be talked about. Therapy in this middle phase also we talk about the idea of being dependent and independent. So eating disorders represent sort of an avoidance of kind of being alone, as well as an avoidance of being together. So these are the kinds of themes or things I'll talk about with patients in terms of their own abilities to be with themselves and others. Moving away from this kind of externalization model is thinking about what part of part of oneself does the eating disorder represent, and how can that be kind of integrated into the self? Does it feel like a bad part, a part you need to get rid of, feelings that can't be tolerated or won't be can't be expressed because of worries of annihilation or fragmentation? And it accounts for the idea that there may be lapses in symptoms